Healthcare stocks staging a big rally following today's Supreme Court ruling. Many of the stocks even hitting all-time, lifetime highs. So, Matt McCall, are these getting too pricey in here? Are you still buying these guys?
I wouldn't buy them tomorrow. I mean, a lot of the hospital stocks were up 8, 9, 10%. We got lucky. We bought HCA about 10 days ago, and it was up huge, say, all-time high. I think they will continue to go because by keeping its subsidies, basically what the government's doing is saying there's more paying customers for your business. So if somebody's paying customers to walk into my business, my stock's going to be going higher as well. And the health insurers, the United Health, the Aetnas of the world, they've been going up as well because we're going to see a lot of mergers in that area. But they didn't rally as big today because they don't get as much revenue from the subsidies that are going on.
Okay. So what we're going to see a lot of are the diagnostic companies, the companies that make a lot of money from procedures, from outpatient procedures. Because the key here is, of course, Medicare continues, to attract more and more senior citizens. And how do the doctors make their money? How do the hospitals make money? They just keep they look for chronic illnesses. They're testing everyone to death, literally.
Right.
So the other thing you want to be looking at are companies like Johnson & Johnson, J&J. They have a lot of diagnostic equipment in addition to having pharmaceuticals.
But what about the medical device tax? Isn't it killing those guys?
Well, I wouldn't worry about that as much as the fact that the doctors have initiative underneath them because some of their costs continue to get squeezed or what they're paid. So they're just doing more and more volume. So no matter what there are in terms of those taxes, you still want to be in Medtronic.
It's like Quest Diagnostics. Every time you go to the doctor, you have to get blood at Quest Diagnostics, like a company like that.
I told you I went into the doctor.
Yep.
He punished me. He sent me off for all these tests. I'm telling you. Tammy, let's talk the subsidies and the deductibles, because a lot of people, all they're looking at is premiums. I think the deductible is the real devil in the details.
The co-pays as well. So you've got a deductible issue, you've got the co-pay issue. As an example, the bronze plan, which is what everybody who needs subsidies is going to take. So you think, oh, I can get the bronze plan. That's the cheapest. There's no real choices about where you can go. You're going to wait not a million years, but close for an appointment because everyone's there. There's limited hospitals and doctors who will accept you, and you've got with the subsidy, perhaps $100 a month. And then you think, oh, great, I've got health insurance and I can afford it. It's $25 a week. And then you go to the hospital and suddenly you have to pay $2,000 because your deductible is $5,000, or even the copay is going to be a certain higher percentage than it ever was before with the insurance as it was before. And that's where the shock is. A lot of people have not had to use this insurance, and they don't realize that having health insurance is not getting health care.
And let's go back to the product. And USA Today had a fabulous long piece today about the fact that a lot of people, then this is what's going to happen. They're not using it because they've heard these stories about, oh my gosh, I can't afford that copay, I can't afford the deductible. So they're backing off and they're asking their doctors, do I really need to take my prescription every day or can I take it every other day?
So this has been the story, and the Obama administration said, oh, it was a recession, people couldn't afford it, so they didn't take care of themselves, they didn't go to the doctor, they didn't buy their meds. In reality, I think what Tammy and you are describing is much closer to the truth. People are not taking care of themselves because they cannot afford it.
You concern me, Jerry Wills. Tom, she had 2 cookies before the show. That's what the problem with this. Diabetes, high sugar, 2.